What are the benefits and drawbacks of this approach from your perspective?
Well, I think there are lots of benefits. Truly, in many circumstances, collaborative practice is simply a contract. It doesn't actually ensure safe patient care. It doesn't really ensure that there's good collaboration or communication between a physician and an APRN. So, from my perspective, I think we should focus on truly collaborating, getting patients to the right level of care at the right time, to the right clinician at the right time, and focusing our efforts not on contractual agreements, but on which clinical discipline the patient would benefit most.
How can collaboration between physicians and nurse practitioners be optimized to deliver the best possible care for patients, regardless of the practice authority model?
I think if we can take the competition out of it, um, we're all better off. Sometimes professional organizations take this approach where they're pitting one clinical discipline versus the other. And honestly, we're all better if we work together. Um, Recently, in my role as president of OAAPN, I was honored to partner my organization with the Ohio State Medical Association to work towards comprehensive legislation to make care more efficient for APRNs. And this doesn't have to be contentious. It truly can be meaningful collaborative work with one another. I think this is demonstrative of the work that all organizations could do to come together and keeping patients first.
So, is this the involve the work for the win that you received at the State House?
Yeah, so we recently had proponent testimony for Senate Bill 196. We have a coalition of like-minded organizations that are focused on enhancing access for patients that are supportive of this common sense legislation and a real bipartisan effort to make care more efficient across the state.
So, is there any more that you want to elaborate on that particular House bill for the layperson?
To the layperson, this is an efficiency for you. If you come for a pre-employment physical, you could currently experience a scenario where you are being evaluated by an APRN, but that form may need to be signed by a physician, which means that you may come in for your visit, but then have to come back to get a signed form by a clinician that didn't actually perform your exam. So, thinking about it that way, from a patient lens, this legislation just makes sense.
It does, because I would feel some kind of way that I have to make these additional trips. It does. It does. Well, congratulations on that. Congratulations. And even the collaboration between all parties who understand, who identify, understand, and recognize that how beneficial is this for our patients at all, and affecting some a policy change to strengthen access for our patients. So I applaud you guys, and congratulations on that win.